Hi, my name is Greg Fellow, I'm Director of Public Health in Sheffield. This is today's COVID report from the 16th of November. So epidemiology first, case rates trending down, has been for a few weeks now. As of today, just below 300 per 100,000 and has been trending down, and I don't see that trend ending. It will end eventually, and I don't know where it will bottom out. Trending down in all ages, a sustained fall in all ages, which is obviously good news, particularly for the elderly. The trend in hospitalisations is also down, but that lags behind the case rate. So I think there'll be a slower, later decline in the harm that comes from this. We are still seeing outbreaks in lots of businesses, lots of other places. In short, I think people let their guard down, and that's how the outbreak starts. So it's worth remembering that it is still out there. We're seeing rates coming down, but there's still a lot of it out there, and it only takes a momentary lapse, and then you have a new outbreak to contend with, and that can be bad for those affected, obviously. It's worth remembering it's still out there. It still makes people poorly. Hospitalisation rates are high, going down slowly, and I'll come on to the NHS in a sec, but it still makes people poorly, and it's avoidable. Most of the transmission we see is within household, from people that you know, and again, you spend more time in your households and your guard is arguably down. So that's where we see most of the transmission is within household, to a lesser extent between household. So it's, if COVID is in your household, it's not guaranteed that it will rip through the household, so to speak, and you can significantly reduce the risk of that happening. And there's some really, really helpful advice from Sage, which we'll put a link at the end of the video. It's impossible to say where this will go over the next couple of weeks to months. Probably a gentle settling of the COVID rate and the harm that comes from COVID over the course of the winter, possibly clearing up in spring. I certainly hope so. The NHS and social care is exceptionally busy, and it's not just COVID. COVID definitely isn't helping, but it's not just COVID. All bits of the NHS and social care, clearly we all see hospitals in the news quite frequently, but ambulance services are exceptionally busy, primary care is exceptionally busy, obviously A&E, and all bits of social care are exceptionally busy, and this is before flu season starts. So and that matters, because obviously flu is going to exacerbate this further as we go further into the winter. So important note, get your flu jab if you haven't already done so. But secondly, the delays to care and the care that isn't given, because the NHS and social care is rightly providing urgent care for people with respiratory illnesses, does matter actually. So it's important that we, one, look after each other, and two, please be patient with NHS and social care professionals. They are doing their best to help you, but please be patient with them. What can we do? Same old, same old. Most importantly, vaccination. Booster is the thing of the moment. Uptake rates for boosters are quite good. I'll come on to that in just a second. Work from home if you can. Wear a mask, particularly in enclosed public spaces. That has made a difference, no doubt. If you have symptoms, get a test. Stay at home, and arguably even if your test is negative, if you've still got symptoms, stay at home. Who wants your flu? Nobody wants your flu or your severe cold, and there's a very, very severe cold going around at the moment. I've had it, it's horrible. So even if the test is negative, don't spread your respiratory bugs at work or at any other setting. And as I say, please be patient with NHS and social care professionals. They are there to help you. They are doing an exceptional job under exceptionally difficult circumstances, but please be patient with them. So then on to vaccinations in particular. So obviously the 12 to 15 programme continues. That's going as quickly as it can, and hopefully will have been around all schools in the not too distant future. Uptake of that is pretty good actually, better than I expected. Welcome news from Joint Committee on Vaccinations yesterday that 16-17-year-olds will be offered a second dose, and this will be given 12 weeks after the date of the first dose. And again, absolutely welcome from me. Also welcome news from Joint Committee on Vaccinations that people aged over 40 and over, so in this cohort between 40 and 49, will be offered a booster. If you're aged over 40, you'll be able to book your booster from the 22nd of November, i.e. next Monday, on the National Booking Service. All up, booster uptake has been pretty good. It's been very good in the very old, and obviously that will go down through the age cohorts, but all our booster uptake is going very well. People are choosing to get the booster. They're voting with their feet or voting with their shoulders, more to the point, and that's good. We remain concerned about waning immunity, and we are definitely seeing the impact of boosters on transmission rates in those cohorts that have had good uptake of the boosters. So to date, they've been offered to anyone aged over 50, frontline medical and social care staff, and people with health conditions that put them at greater risk. And as I say, as of yesterday, that minimum age group has been lowered to 40, which is welcome news. As I say, the reason why we're doing boosters is because COVID immunity does decline more quickly in older people than younger people, and partly that's also to do with the time from when you had your second dose. We vaccinated the elderly first for good reason. So if you have if you've had an invite for a booster, please take it. The most important thing, if you haven't yet had dose 1 and dose 2, and many tens of thousands of Sheffielders haven't, please do so, because that is by a distance the most important thing you can do to protect yourself from what is a pretty serious illness that is still in Sheffield in reasonably large quantities. We were vaccinating at the Moor Market last weekend. Quite a few people came up who hadn't had their first dose. It is never too late. Even if you think you've missed your slot, I just didn't get round to it at the time, it's never too late, and there are many vaccination sites operating across Sheffield you can walk up to without an appointment. We will be back at the Moor Market with a vaccination pop-up fairly soon, so please look out for details. It will be on social media. In the meantime, you can find out more about where you can get your vaccination clinic is and get an appointment booked on the website. And please do so that, because it does remain the most important thing that you can do. Lastly, flu season is nearly upon us, and it's never too late to get your flu jab.